In an extremely rare case, a patient who received chimeric antigen receptor (CAR) T-cell therapy for cancer developed a second cancer arising from the treatment itself. CAR T-cell therapy, a cutting-edge cancer treatment, involves harvesting a patient's immune cells, genetically modifying them to target and attack specific cancers like lymphomas, leukemias, and multiple myeloma, and then reintroducing them into the patient. Approved in 2017, CAR T-cell therapy has been transformative for many, but its long-term risks are still being studied. While secondary cancers occur in 4% to 16% of people following chemotherapy and radiation, only about 20 cases of T-cell cancer after CAR T-cell therapy have been reported to the FDA. This is rare given that over 34,000 people in the U.S. have received CAR T-cell treatment. Despite the low risk, these cases have prompted the FDA to scrutinize potential causes and risks of CAR-related secondary cancers. The FDA maintains that the benefits of CAR T-cell therapy outweigh the risks but seeks to understand these risks better. A recent case study published in the New England Journal of Medicine details the experience of a 71-year-old woman with multiple myeloma who developed a new cancer in her intestinal tract 4 months after receiving CAR T-cell therapy. The cancer was CAR-positive, suggesting it arose from the modified immune cells used in her treatment. The new cancer cells had genetic changes likely due to the CAR T-cell modification process, which involves using a virus to insert new DNA into the immune cells. However, no significant genetic changes directly explained why these CAR T-cells became cancerous. Experts like Dr. Martinos Demerli and Dr. Paul Machocha note the complexity of assessing the risk of secondary cancers from CAR T-cell therapy. Each patient's genome is unique, and the gene insertion process is random, complicating risk assessment. This case underscores the importance of analyzing the DNA of CAR T-cells before reintroducing them into patients to minimize the risk of introducing potentially cancerous cells. Advances like CRISPR-Cas9 could offer more precise DNA editing, potentially reducing such risks. While this case highlights a rare complication, the overall risk remains low, and the life-saving benefits of CAR T-cell therapy generally outweigh this risk. Patients and clinicians should remain vigilant but not overly concerned about the potential for CAR-related secondary cancers.